We at Families USA strongly endorse the House bill that's been introduced because we think it significantly deals with the key values that consumers are really looking for as part of health care reform. It provides choice. It makes coverage affordable. It ensures that coverage will be stable. And it ends discrimination among insurance companies. Now, with respect to choice, we've heard said numerous times that this plan, as well as the President's principles, you can keep the coverage that you have if you like it. I remember Mr. Klein indicated early on in the hearing that he raised questions about 23 million losing coverage as a result of a CBO score of the Senate Help Committee. Of course, if you look at the CBO score, you'll see that they've said it's an incomplete analysis of an incomplete bill. And I don't think we're going to see anything like that with respect to the House bill. This provides new opportunities to get coverage if you're in a small business. It creates a health insurance exchange which does something which the American public wants, namely, they want to have the same kind of options that members of Congress have, and the health exchange is going to provide that opportunity, and in so doing, it'll provide accurate and helpful information about benefits and rights. It creates reasonable rules about how insurance companies should operate so that if you have insurance, you actually know what you're getting as opposed to find out that you didn't have something at a point when you need care. And it provides a public option that we think is very helpful because it not only provides more choice, but it provides a real opportunity for getting costs down, and it provides a stable, portable option. Now, another value that consumers care deeply about is making coverage affordable. And one of the key ways that this plan makes coverage affordable is through the new subsidies that are provided on a sliding scale up to 400% of the federal poverty level. We think that is absolutely critical. It also places a cap on out-of-pocket costs. It's not simply the premiums that people pay in order to get coverage. They also pay deductibles, co-pays, and there may be a cap in how much an insurance company pays out. Now, when people have coverage, they won't be bankrupted, they won't be surprised, and that care will be affordable to them. And it provides an important safety net through the Medicaid program by establishing a floor on eligibility of 133% of the federal poverty level. Mr. Andrews and Mr. Scott were talking earlier about the kind of cost shifts that take place when people don't have coverage. And we released a study that the President cited last week that showed that in 2008, the cost shift, the hidden health tax, if you will, for those who have coverage to pay for the uncompensated health care costs of the uninsured in 2008 was $1,017. And I would suggest that this year it's considerably higher because more people lost their jobs and in the process lost their health care. It's probably closer to $1,100. This plan also ends insurance company discrimination. You no longer can be denied coverage due to a pre-existing condition. When you get coverage, you're not going to have a loophole so that everything is covered other than your pre-existing condition. It means that insurance companies are not going to drop you or raise your rates due to the filing of a claim. It's going to mean that post-claims underwriting that happens all too frequently, that you get coverage, and then when you need care, the insurance company says to you, you actually didn't disclose certain kinds of things, and they drop you from your coverage. And it makes sure that insurance premiums are not going to vary based on health condition. Lastly, this plan provides coverage we can count on. It provides coverage for preventive services that are very important. It will provide coverage based on the best science. Yes, there will be a Health Benefits Council that will work with the Secretary, but that Health Benefits Council will be charged with coming up with the best science so that health plans are developed that really make sense, and therefore we won't have enormous waste in our system, which we have today. And it will provide a range of insurance options. In short, I don't remember, one of you talked about health insurance coverage like a house. Well, this plan doesn't make you get out of the house. It doesn't make you sell the house. But what it does do is it gives you tools. So if you got a leak in your roof, it can be fixed. If you need an addition to your house, it can be fixed. It means if you need some remodeling, it can be fixed. And so I say to you, Mr. Chairman, we are delighted to be able to say we strongly support the bill that has been introduced, and we will work tirelessly to see that it is enacted this year.